Endometriosis is a chronic disease that can cause excessive bleeding, pain, inflammation, infertility, and more. Many experience such agonizing pain that it debilitates their daily life. This is the reality for millions. Endometriosis affects up to 1 in 10 women, and these aren't just statistics. That's your mom, your wife, your daughter.
But medical discrimination has caused endometriosis to be severely underdiagnosed. Diagnoses take on average 10 years, and as many as 6 in 10 cases remain undiagnosed entirely. When my mom saw how expensive her bills were through years of appointments, we were inspired to help people like her. We believe that women deserve answers, faster, easier, and with the care they need. I'm Addison Wu.
I'm Emily Fan.
And this is EndoSense, making women's health make sense.
Made by women, for women, it's the first at-home non-invasive rapid test for endometriosis. Instead of taking 10 years, get results in less than 20 minutes.
EndoSense consists of a multiplex lateral flow assay for proteins and a multiplex nucleic acid biosensor for microRNAs. So how does it work? Users use a menstrual cup to collect a fluid sample, which flows across the membrane strip and binds to conjugated complexes on the test lines. A color change indicates a positive result. The multiplex assay measures multiple biomarkers simultaneously, decreasing time and cost and increasing accuracy. Titanium nitride nanoparticles further enhance sensitivity. After consulting 18 doctors and professors and proving concept viability, we optimized flow rate and dimensions by testing a prototype membrane, finding the ideal sample pad size to be 1 centimeter for a rate of 120 seconds for 4 centimeters.
EndoSense also features a paired app where users can take a picture of the results, and an AI algorithm adds numerical metrics to analyze the intensity of test lines' colors to determine a diagnosis. Using our AI to visually audit assays led to a greater than 25% increase in accuracy and up to 99% compared to readers. Users can also use the app's built-in calendar and journal to create management plans and predict flare-ups. An end-user survey will collect feedback for further improvements.
No non-invasive rapid tests for endometriosis exist on the market today. The only valid diagnostic, laparoscopic surgery, can cost up to $13,000. Existing non-invasive imaging methods are too imprecise to diagnose, and other biomarker tests in development require lab work, making them expensive, slow, and inconvenient. With EndoSense, instead of thousands of dollars and years of waiting, a $30 rapid test delivers instant, accurate results, right at home.
We aim to differentiate ourselves by eliminating the stigmatized and restrictive nature of diagnosis, costs of middlemen like specialists or lab technicians, and side effects of invasive procedures. We'll reduce the overall cost of diagnosis, shorten turnover times, and decrease inaccuracies. Unlike single biomarker tests, we conducted a meta-study of literature to find a panel of proteins and microRNAs with the highest sensitivity throughout various presentations and stages. We'll raise the diagnostic speed, improve ease of use, and scale through retailers for earlier detection. EndoSense creates a new market space as the first fully at-home usable test, integrating AI for analysis and patient support resources.
Currently, the industry focuses only on productivity of use, but EndoSense utilizes the Blue Ocean strategy to make it simpler, cheaper, less risky, and more accessible and convenient to buyers. Instead of just being a test, EndoSense revolutionizes diagnostics by integrating treatment plans through our personalized app. Our primary market includes 500 million targetable young women. With the prevalence of endometriosis increasing demand, our total addressable market would be $15 billion, and based on projected adoption rates, our serviceable available market would be $1.5 billion, with an expected serviceable obtainable market of $600 million.
Current customers include those who have undergone invasive surgery or rely on inaccurate screenings. Our soon-to-be non-customers are frustrated by long wait times, high costs, and dismissive doctors. Refusing non-customers avoid diagnosis due to fear, stigma, or unaffordability, and unexplored non-customers assume their symptoms are normal or are unaware of endometriosis.
In the first months, we will focus on filing for patents and securing FDA approval through R&D and clinical trials. We will outreach to hospitals and pharmacies, presenting at conferences and offering trial kits to gather feedback. To fund the $3 million initial capital, we will pitch to investors and apply for endometriosis grants. For example, NIH Omnibus grants offer $300,000 for R&D and then another $2 million for clinical testing.
In the first year, we'll finalize distribution agreements. Targeting 25% of OBGYNs, we estimate $36 million in annual revenue from clinical use. Negotiating licensing deals with pharmacies will generate another $12 million in royalties. We'll also leverage social media, digital marketing, SEO, and support communities to raise awareness and brand recognition. In the years following FDA approval, we'll scale production and launch sales. At the low price point of $30, with a $28 profit margin per unit, hundreds of times cheaper than any alternative, we'll reinvest into expanding marketing and sales globally, solidifying EndoSense as the leading diagnostic tool.
As a breakthrough innovation, EndoSense is a low-cost, feasible, and commercially scalable solution to deliver life-changing diagnosis for millions in need. More information can be found on our website. Join us in revolutionizing women's health
So no one has to suffer in silence.